I am Professor Jennifer Chips, the Director of the School of Nursing here at the University of the Western Cape in Cape Town, South Africa. I've been asked as part of the launch of the JBI Evidence Implementation Journal to do a short commentary on a best practice study by midwives on immediate newborn care. Now, the reason we focused on immediate newborn care for this study was that we know that in 2018, 2.5 million children died within the first month of their lives, 1 million within the first 24 hours after birth. Now, that is approximately 7,000 newborn deaths every day. Now, where I'm from, Sub-Saharan Africa, we have the highest neonatal mortality rate with 28 deaths per 1,000 live births recorded in 2018. And that means that a child born in Africa, in Sub-Saharan Africa, is therefore 10 times more likely to die within the first month of their lives compared to a child born elsewhere. Now, we know that to improve neonatal mortality and morbidity, it is essential that we address the preventable causes of these newborn deaths. And to this end, the WHO has developed a series of comprehensive evidence-based practice care bundles for newborns based on these main causes of neonatal mortality and morbidity. Now, these include thermal protection, that is the promotion of skin-to-skin contact between the mother and the infant, hygienic umbilical cord care and skin care, early and exclusive breastfeeding, preventive actions such as immunization, and the assessment for signs of serious health problems that need to be identified early and referred. Now, in Ethiopia, they have recorded around 87,000 newborn deaths every year in the first month of their lives. Now, the majority of these neonatal deaths occur due to these preventable causes, but also a failure to implement best practice care bundles. So, to address this, a study was conducted on the compliance of immediate newborn care practices among midwives working in the maternity wards in Ethiopia. And this study was conducted by 3 people, Senabelina Ketila, Garuma Tolu Fayeza, and Murankar Sudakar Narayan. So the aim of this study was to improve the compliance to evidence-based practice protocols by the midwives in these maternity units to improve the outcomes for newborns in Ethiopia. So the study was conducted in 3 steps. First of all, there was engagement with the stakeholders, and through this process of engagement with the stakeholders, they identified the levels of compliance and barriers and gaps to the improvement of the adherence to these care bundles. And based on this information, a number of strategies were developed to address non-compliance. This was followed up by a baseline audit, which was repeated after the intervention. So a baseline and a post-implementation audit was done of 94 cases, 50 midwives and cases on the baseline, and then 44 after the intervention. And they used the JBI PACER system to audit 9 criteria of immediate newborn care as per the WHO care bundles. So starting with the audit, overall, the compliance was low. They only had about 58% compliance to the overall adherence to these protocols. And nearly 3/4 of the midwives had not received any specific education on immediate newborn care. Looking at specific criterions in the audit, generally education on exclusive breastfeeding showed the highest level of compliance, and that is criteria number 8. But they found very poor compliance for criterion 5, which was hygienic cord care, with nearly half of the observed cases, and criteria 9, which is education on thermal care, with nearly 3/4 of the observed cases. So following this audit then, where they've discovered this low level of compliance, they analyzed the gaps and the barriers using the JBI GRIP process of getting research into practice to identify some implementation strategies. And based on this, 3 main strategies were developed. First of all, it was felt that it was really important for them to have an education and an introduction about what is evidence-based practice and why it is important. Together with that, they provided them with evidence-based summaries of immediate newborn best practices. And they developed a protocol for training based on the WHO immediate newborn care training package. So this was implemented for a period of time and then was followed up by a follow-up audit. And so what they have found at the follow-up audit was that 95% of the midwives now had received specific education on immediate newborn practices. Then they looked at the observed practices. Overall compliance have now moved from 58% in the beginning now to 95%, with 100% compliance to criteria number 5, which was hygienic cord care, 98% compliance to education on thermal care, and the compliance with exclusive breastfeeding remained high at 96% compliance. So though this project did not actually follow up the outcomes on newborn mortality and morbidity, the improved compliance of the midwife provide evidence that the best available evidence in immediate care would result in improved outcomes for newborns in the future in the setting. For me, this little project is a wonderful example of how a team in Ethiopia, in sub-Saharan Africa, were able to take research as evidenced by the WHO care bundles and facilitate it through a structured process using the JBI PACE and the JBI GRIP, implement these and see an improved compliance as an outcome. In reflecting on this project, we know that evidence-based practice has become the gold standard for delivery of safe nursing care and to achieve the optimal outcomes for our patients. But we know that bringing research into practice has remained elusive and have not always been successful. But when we look at this little project from Africa, from Ethiopia, I do hope that it will inspire other health workers to aim to do the same and to bring real research evidence into our clinical practice and thereby improve the outcomes for our main focus group, which is our clients. I would like to end this commentary with a strong endorsement of the JBI Evidence Implementation Journal. This is a journal that will bring examples for us of studies that have tried to do exactly that, to bring in research evidence and implement it into practice. And this journal will engage and continue to engage the global healthcare community's interest in implementation and in implementation science, which is a very important area. That is all from me. I hope that you've enjoyed this short commentary, and all of the best from us here in sunny Africa.